everyone, and welcome to another episode of A Closer Look. I'm Arabina Apia. Thanks so much for tuning in. Tonight, we're focusing on the ongoing transformation of public healthcare in the country. From renovated clinics and expanded services to digital tools and workforce development, the goal is clear: to build a system that's more responsive and more equipped and more connected to the needs of our communities. We take a closer look at all of that and more right after this break.
So one of the things that the Ministry of Health and Wellness is doing is pushing the thrust towards digitization of the health sector. That would allow patients to access their health information at any site that they seek services at, whether it be in country or out of the country. So you receive a highly quality care in Inagua. That record follows you, and what happens with you in Exuma is available to the physician in Inagua or Grand Bahama or even New Providence if you were to come here for a reason. And if there's for any unfortunate reason you now have to seek tertiary level care at one of our hospitals, they also have access to the information to assist and aid in the ability of you to manage your case.
Across the country, several community clinics are getting some long-awaited upgrades. This as part of ongoing efforts to alleviate the pressures on public hospitals. Erin Scavella has more in our top story.
Major clinic upgrades are underway in Nassau and the Family Islands, signaling what the government of the Bahamas is calling a new era for the public healthcare system. Officials say the move is part of a push to strengthen primary health care across the Bahamas. With groundbreaking set for a new clinic in Coconut Grove and upgrades completed at both the Anstown and Blue Hill Road clinics, officials say the plan is to alleviate healthcare pressure at the Princess Margaret Hospital. The Anstown clinic officially reopened its doors recently to reveal a full transformation of the now 7,200 square foot facility. It's not just bigger, it's better. With more examination rooms, an in-house pharmacy, a full laboratory, and diagnostic services, this clinic is designed to reduce wait times and provide care closer to home. And the $10.5 million Coconut Grove Advanced Healthcare Center is scheduled to be underway.
This is a new beginning, but it's also a clear sign. We are building a healthcare system worthy of the people it serves.
Over at the Blue Hill Road Clinic, services have been expanded to include everything from childhood immunizations to digital records.
This newly renovated clinic, at this particular site, we can see families and children receiving care, comprehensive services, child and adult immunization, including digital record searches, health education sessions, and international travel health clinic services.
Residents on Cat Island, Moores Island, and Stanyo Key can also expect similar healthcare upgrades to their infrastructure. This work continues with a multi-million-dollar health campus in the nation's second city as well. From preventative care to emergency relief, the reimagining of local clinics indicates a long-awaited shift. With these changes, government and health officials alike hope the country moves forward to a healthier Bahamas. For a closer look, I'm Erin Scavella.
Thanks so much, Erin. Now, the Department of Public Health is introducing digital tools to help improve service delivery and streamline operations across the board. ACL's Amber Arana has that story. Amber?
The future of healthcare in the Bahamas is going digital. From faster patient check-ins to real-time medical data, the Ministry of Health and Wellness and the Department of Public Health are rolling out tools designed to streamline public health services in the Bahamas. In clinics nationwide, handwritten forms and long lines are being replaced with clicks, scans, and seamless data. It's part of a nationwide shift spearheaded by the Ministry of Health and Wellness alongside with the Department of Public Health to digitize the public health system. We visited Anstown Health Center where we spoke with head nurse Monique Lewis, who demonstrated and spoke to how these apps are used in clinics.
We're introducing the SIP Plus, and it is the digital antenatal passport and book record for perinatal records for our antenatal clients. It gives us the opportunity to enter the information that our clients would normally have handwritten, documented in their SPCR booklets that we would keep at the clinic and then document their information and forward to maternity ward at the end of the shift.
The new Bahamas EMR Plus system is the backbone of this transformation. It links patient information across facilities, allowing providers to access records in real time, cutting delays, reducing errors, and improving continuity of care.
With the SIP Plus system, once you would have entered the information into the system, you don't have to worry about a transport officer coming to the clinic to pick up the information to transport to the hospital, but you can have access to it in real time. With the ER information, the same principle applies, but it's not limited just to the antenatal client. It is for all clients at any level. Also, it provides the information to be easily accessible by clients who come to us from the family island. This particular system allows the nurse who is in Mayaguana not having to worry about trying to do a teleconference with a doctor to find out exactly what it is that was done with the client, or trying to rely on relatives' memory to say what the doctor said, because now you're able to go into the computer, pull up the client's file, look at the records, and see what was done for the client while they were in New Providence. So that is a great plus.
Officials say these digital upgrades are laying down the foundation for a more efficient, inclusive, and data-driven healthcare system in the Bahamas. For a closer look, I'm Amber Arana.
There's more of a closer look on the other side of this break, so stay tuned.
Good day, I'm Dr. Gregory Pinto, Bahamian urologist. I'm here to speak about the importance of men's health and getting your annual physicals. You're doing it not just for you, but for your loved ones. Prostate cancer is the #1 cancer in this country. Over 100 men are dying needlessly of prostate cancer. Prostate cancer, if picked up early, has a nearly 100% cure rate. Please visit your nearest physician. Your future and your family need you healthy.
This message is brought to you by the Department of Public Health.
You know, I want to make people laugh and cry.
You soon can be at CAPAS, the Bahamas School for the Creative and Performing Arts.
I want to be creative.
I want to do hair and makeup for movies.
I want to make those big sets for the stage.
I want to make radio dramas and podcasts.
I want to be a dancer.
Singing, dancing. You can learn them all at CAPAS, the new school for the creative and performing arts.
Lights, sound, camera, action.
Writing, singing, dancing. You can learn them all at CAPAS, the new school for the creative and performing arts.
I really want to be an animator.
I want to be famous.
Go online to register your interest, have your say, and learn more about CAPAS, the School for the Creative and Performing Arts.
I want to be a
Welcome back. Nurses are often the backbone of our public clinics, but in the face of burnout and other issues, how is the system investing in their growth and retention? Krishna Russell has more in this next story. Krishna?
Nurses, doctors, and frontline workers are the backbone of public health, and now an effort is underway to strengthen it from the inside out. Behind every hospital bed and clinic check-in are the professionals who keep the system running. With ongoing training and professional development, the public healthcare system is not only upgrading its process, but their team members as well. Kimberly Josie McPhee, a training officer in the Department of Public Health, told A Closer Look that building a good foundation for nurses is a vital component in their development. A recent orientation set the foundation, which centered around human resource components for best practices in the workforce.
Well, this orientation is very vitally important because what it does is it gives a structured introduction to our new hirees as to the purpose, their job description, what is expected of them, their roles and responsibilities, and the policies of the Department of Public Health. It's talking to them about what are their benefits, what are their entitlements, what are their job descriptions, and everything so that everyone will be on one page.
Once that foundation was set in that 3-day orientation, the nurses were then educated on the various program offerings at the Department of Public Health. As senior trained clinical nurse Chantel Brown said, the training was an opportunity to see the department from a different point of view.
A lot of times we come into nursing and we think that it's just about the clinics, but the Department of Public Health, they offer a lot of programs that actually reach into the homes and the families of persons. And you actually get to see how people are actually living and how we distribute medication, how we do teaching, how we do information.
She acknowledged that the knowledge gained was welcomed.
As a student in this orientation, I really appreciate it, and it made me more privy to information that I did not know, and it's going to help me with my skills, my experience, and my training when I come on to staff as a registered nurse.
A well-trained workforce is key to desired patient outcomes. And as these programs show, the Bahamas is not only investing in equipment, but in talent. For A Closer Look, I'm Krishna Russell.
Thanks so much, Krishna. That was really great information. Now, we've seen the upgrades, the tools, the training, but how are these changes being received by the people who rely on the public health system every single day? Well, we took to the streets to hear directly from Bahamians, and Aaron Scavella has to tell us all about it. Aaron?
As the government expands community clinics and access to healthcare across the Bahamas, we wanted to ask everyday Bahamians how they feel about the current healthcare system and what upgrades they're looking forward to. From physical renovations to digital records, the government is working to modernize public healthcare. But are the upgrades making a difference for those who matter most? Patients.
I think it's well needed. It actually would be a great aid to a lot of the individuals who come there and be useful for a lot of the nurses that will be coming in and doctors.
Upgrades are happening at clinics like Anstown and Blue Hill. But is the public aware of the changes? And are they seeing results where they live?
I feel like it's very much needed because you wouldn't have to travel too far for like urgent care or anything like that. You just could get that at a facility where you live close by.
I think improving things on the Family Islands is definitely a step in the right direction because there's not as many resources out there compared to New Providence.
The move to digital records is one of the biggest shifts in healthcare right now, with the goal of making record processing more efficient for patients and healthcare officials.
I feel like it's something that everybody needs to start thinking about, keeping on the phone, even just to check every now and again to see like how things going.
Well, I feel like it's very helpful in the sense that if I go to Fleming Street today and then tomorrow I end up at South Beach, my files would be at every single hospital or clinic, which makes it easier for whatever doctor I go to have every access to any allergies, drugs I on, or any illness I will be.
Even with improvements, gaps remain, from staffing to specialist care. We ask what's still needed to make healthcare truly accessible across the country.
Well, I think if people know that they have better access, they're more likely to use the resources that are available, but I think it's more about letting them know that the resources are available.
There could be some changes with trying to shorten the wait times. I think that having more people on staff would help to make the process move more smoothly.
With expanded clinics and services reaching more communities, access is improving, and so is awareness. But the real impact lies in listening to the people these changes are meant to serve. So whether it's time for a checkup or just a health question, visit your nearest community clinic and take that next step to a healthier you. For a closer look, I'm Erin Scavella.
When we return, we're talking to one of the healthcare professionals leading the charge on the ground of this new frontier in healthcare. Stay tuned because A Closer Look is back right after this.
Hi, I'm Dr. Darius Bain, a family medicine specialist, and I'm here to remind you that your health is your power. Many sexually transmitted infections can go undetected and are asymptomatic, and if left untreated, they can cause serious medical problems later on in life. That's why it's so important that if you are sexually active, you consult your doctor to get tested or screened regularly. It's quick and confidential. Know your status, protect yourself, protect others.
This message is brought to you by the Department of Public Health.
Welcome back. We've examined the tangible changes, the clinic upgrades, the digital advancements, and the workforce development. Now, we turn our attention to the leadership steering these initiatives. Joining me now is Dr. Philip Swann, who is the Acting Director of the Department of Public Health, and with a background that spans clinical practice, public health policy, and international collaboration, he's bringing today a comprehensive perspective on the transformation of our healthcare system. Welcome to the show.
Thank you for having me.
Absolutely. Now, Dr. Swann, let's jump right into it. Let's talk about the primary goal behind some of the renovations and service expansions that we're seeing across the healthcare system.
So the focus really is to rehabilitate the physical infrastructure of the Department of Public Health. We have a network at one point in time of more than 99 clinics across the archipelago. During the course of the decades, some of them have fallen to a state of disrepair. Populations have moved from the Family Islands into New Providence, and so they're not as needed as they were then. And so we're now in the process of working through which are the crucial facilities in those islands, in the larger settlements, that allow us to provide the services that we do to the larger pockets of population out there. So the rehabilitation process is basically just doing some strengthening of the infrastructure, and in some cases some modernization to ensure that they can withstand hurricanes. They can also be more resilient as it relates to taking care of our population.
Absolutely. Well, I know that modernization also includes digitization as well. Can you tell us how that digitization process is expected to improve patient care and data management for patients across the country as well?
So you may have heard me said in the past that our major challenge with digitization, or lack of digitization, was really laid bare during Hurricane Dorian and during the COVID pandemic. Hurricane Dorian, of course, persons in Abaco were displaced to other Family Island locations. So all of their medical records, although they were not destroyed during Dorian, were not accessible to facilities or settlements that they went to. And then, of course, during COVID, we were unable to have that conversation with patients about, okay, you have your medication, what medications you're taking, and have that continuity of care, and allow us to call the pharmacies, request their medications to ensure that those persons who are our most at-risk patients were touched during the pandemic and not lost to follow-up.
Mm-hmm. I know you mentioned that sort of gap following COVID and Hurricane Dorian. Are there any other challenges that the Department of Public Health is looking to address, specifically in the Family Islands, where, you know, healthcare is often challenged?
Right. So we have, the purpose of the digitization is another point, is to ensure that we have continuity of care across our network of clinics. If you go to a clinic today, you get a medical record for that clinic. You go to another clinic, you get another medical record for that clinic. and the two are never shared with each other because there is no communication. We want to have the patients have at least one medical record throughout the public health system, and by extension, as the Ministry of Health moves along with its implement systems for health to make it a national medical record. So that's the first part of it. The second part, of course, is with digitization, we're able to have more conversations with physician specialists in remote locations. So we can have the patient have a follow-up care or have a consultation with a specialist based at Princess Margaret Hospital, the Rwanda Memorial Hospital, in the private sector, or even out of country. But within the comfort of their home or any space they can identify that's secure, as well as with a record of that consultation to become part of their one patient, one health record.
I know too that there are plans in the works to facilitate training for healthcare professionals across the country. Let's talk about that. What does that training look like? Who is eligible, and how have those programs been implemented so far, and how have they been received by healthcare professionals as well?
So we have two sets of programs going on. One, of course, was given birth after the discussions and examination of why nurses were leaving country. So a lot of postgraduate programs were introduced to try to give them a varied career path. There's a program that would have rolled out related to midwifery, have those on a regular basis, but there's one that's going on now. Psychiatric or mental health nurses were also a cohort have just completed. We're in the process of starting a program on community health nursing, and another, of course, in public health nursing. So those are some programs that we've been moving along to try to create career paths, and that's the Department of Public Health perspective. Within the hospital, I think they're doing a few other programs like surgical nurse training as well as renal nurse, but they're specialists for the hospital specifically, and that's nursing. But in addition to that, with the expansion of healthcare infrastructure, especially at the tertiary level, there's training for more registered nurses as well as trained clinical nurses with additional skill sets to allow them to support the system more. Patient care assistants are also being trained to support, again, we call them nurse extenders, nurse support, to allow them to go into the communities and do what is necessary to try to reach those persons who are lost to follow-up, and that's nursing. From a physician standpoint, we're looking to restand or stand up again the Office of Medical Staff Development to identify specialist training across the world, really, to ensure that our physicians are moving along the career paths that they are and not stuck in one place or the other. And so we spent a lot of time in the past just thinking about nurses and physicians, but there are other areas of healthcare workers that we need. Pharmacists, for example. The ministry has engaged the Bahamas Baptist University College for a pharmacy program that has just recently received NACOB accreditation, and I understand that they expect to start that in July of this year. In addition to that, there are farm technologist programs, technician programs that are happening in Doctors Hospital as well as Princess Margaret Hospital, PHA Academy. And we have had persons go into that to support the pharmacy delivery care. The other specialties we're looking at, of course, are imaging, lab technicians, as well as surgical technicians. And these are all programs that are on tap to be developed, along with physiotherapy and occupational therapy. Again, outside of medical and nursing, but in the health field, that will strengthen the system and provide persons who don't have the academic aptitude to do nursing or medical training to do something else in the health area.
Well, Dr. Swann, you've spoken at length about the training processes, the training programs that are now going to be available. I want to talk to you, though, about sustainability, because with all of the upgrades, with the digitization, the modernization, what are the DPH's plans to sustain this effort and to build upon this effort for future generations of healthcare providers, healthcare receivers in the Bahamas?
Right, so that's a multifaceted approach. Again, with the infrastructure increase or enhancement, we do intend of course, distributing to our clinics, or to our family islands, I should say, diagnostic sites, so lab services as well as imaging services. So the training that we're talking about will be supported by those individuals who will be trained in those specialties. As it relates to training, again, programs will be NACOB certified with Bahamas Baptist University College as well as PHA Academy. So there'll be ongoing training available for persons. And our hope is to really have enough persons to not just saturate the public sector, but also support the private sector. And the other part, of course, will be maintenance programs. We understand that we are not well practiced at maintenance programs, so we are in the process of developing what is the strategic maintenance unit to ensure that our equipment and our buildings are all maintained in a way that benefits the Bahamian people and secures the funding investment that has been made.
Well, I guess my final question, Doc, would be, what can Bahamians expect to see? What tangible things, outside of what has already happened, what tangible things can Bahamians expect to see in the next 6 to 12 months?
So 6 to 12 months, I think you would see more of this digitization coming to life. For persons who are pregnant, you'll have access to a digital platform to track your pregnancy. And the physicians that you're seeing will be able to track your pregnancy as well. But those children who have children, immunization registry will allow you to track your child's immunization status, as well as to allow you to print off your own certified immunization record for persons who are seeking employment or seeking other types of pursuits. The equipment or the facilities that you see more of upgrades, more of the opening and expansion of the physical infrastructure over the next 6 months. And the ability is really to try to ensure that we have physician and nursing staff in those facilities to provide the care that is required.
Well, Dr. Swann, I want to thank you so much for being here. I know this conversation is one that's going to continue, and I hope to have you back so we can continue that conversation talking about the upgrades that Bahamians can expect to see over the next 6 to 12 months. Thank you so much for being here.
Thank you for having me, and I'm looking forward to a return invitation.
Absolutely. Well, we have more of a closer look right after this, so stay tuned.
Hi, my name is Dr. Martisha Nordich-Smith, family medicine physician, and I'm here to remind you that a healthy pregnancy starts with the right care. Antenatal checkups help to protect both you and your baby. From monitoring growth to spotting risk early, these visits help support you through your pregnancy. Visit your local clinic early and regularly. Every heartbeat begins with care. Start early, stay healthy, and give your baby the best beginning.
This message is brought to you by the Department of Public Health.
Out, guys. 1 minute out. And 3, 2.
Hello, everyone. Be sure to tune in right here every Monday night at 8 p.m. for another episode of A Closer Look, the show dedicated to bringing you the facts. I'm Arabina Apia, your host for this season, and I'll see you right here every Monday night at 8 p.m. on cable channel 212. Tonight's episode hopefully provided a glimpse into what healthcare strategy looks like in real time. With clinic upgrades underway, digital systems in use, and training programs in full swing, it's safe to say that change is on the horizon. Is it perfect? Hardly. But it is in motion, and the results are beginning to reach the people they were meant to serve in ways that are more consistent, more responsive, and more sustainable. I'm Arabina Apia, and I'll be back next week with a closer look at the stories that Bahamians care about. Thank you so much for watching. Until next time, good night, everyone.